City of Johannesburg and the Gauteng Department of Health are in full swing to clear up the current waste management service backlog following the ongoing unprotected strike by Pikitup. As a result of the strike, the city is facing health risks and has seen an increase of food and waterborne diarrhoea. Well, joining us in the studio now to talk a little bit more about this is Qedani Mahlangu. She is, of course, the MEC of the Gauteng Health Department. MEC, thank you very, very much for joining us here on the program.
Good morning, Leanne, and to the SABC listeners.
So we're talking now 5 weeks that this strike has been going on. We're seeing rubbish piling up. I would imagine that the health risks are massive at this point.
The health risks are very real, and as the strike goes on each and every day, the debt is piling up, and of course the more you have debt growing in people piling up in one place, the more risk you have of rodents and rats multiplying and growing every day, and that poses a severe risk for all human beings. And I think what is important to emphasize, Leanne, is that yes, the Constitution gives rights to all South Africans, workers and citizens accordingly. In this instance, we'd like to really appeal to Pikitup workers that their rights are very important, and we support their cause to look at the issues of the better conditions, but their rights cannot trample those of the ordinary citizens and putting the many South Africans at risk. And I think we need to really find a solution to resolve this matter before it's too late.
What contingency plans, or how are you working together with the city as the Department of Health in Gauteng to try and resolve the situation?
Firstly, the city has put up a comprehensive plan headed by the EMS team with Pikitup and all of that. They've mobilized private sector companies to come on board. What the Department of Health is doing is to support from an environmental health point of view, as well as our infectious outbreak response team to go into those areas and ensure that areas where there's a pile-up of debt, those after they've been cleaned, the environmental health look into those and to ensure that indeed there is no any other problem that can be picked up later. And I think of importance here is the highly dense populated areas like the townships, as well as informal settlements in the main, your Diepsloot, Ivory Park, as well as Alexandra. Those we need to pay attention to those, and the plans of the city include those kind of areas as well.
Yeah. Let's turn our attention now to the health risks associated here. I mean, when you read some of the articles that are out and talking about the health risks associated with this piling up of rubbish, I mean, some of those things we can talk about, hepatitis, polio, excreted from human feces, and obviously little babies' nappies that are just lying in the rubbish. I mean, that's the reality of what it's like. You've got diarrhea, gastroenteritis. You've got, I mean, the list just goes on. There's about 100 different viruses that you can possibly get from this rubbish that's piling up in our streets. Have there been any cases that you know of that have been admitted into hospitals?
There has not been any human cases reported as far. That's why, Leanne, our outbreak response team working with the city and the environmental inspectors, it's really to eliminate those. But our hospitals are on the alert to look into this matter because, yes, indeed, this matter was brought to our attention as a result of a rodent which would have been picked up in one of the sites, particularly in Ivory Park in an area called Maibuye, and it was sent to the NICD for testing, and indeed it tested positive for previous pneumonic plague, and therefore we then started getting worried that if indeed this has happened in one area, there's a possibility of it spreading around. Hence, we've decided to go out on a massive communications. We worked tirelessly Friday up until very late to look into what is that we must do to make communities aware, also to have public meetings in those areas, but also to appeal to communities that where people can, they must take their rubbish into the nearest dumping site. And I'm told, including as I entered here, SABC, that some of the parking of the dumping sites are full. And therefore, we need to make sure that that information is conveyed to the city and they are cleared as soon as possible. But over and above that, where people cannot take these things to the dumping site, they must be collected as soon as possible. Of importance, these diseases can be prevented. And that's why rolling out the program of going out to communities communities is to really make people aware and to make sure that at least there's availability of water as quick as possible, because these are waterborne disease and you can prevent them as soon as possible if you have the right interventions in place.
And most importantly, I mean, I do know that, and we were chatting about it off air, I mean, you look at an area like Diepsloot that is almost, I'm going to over-exaggerate a bit by saying it's almost buried in rubbish, but I mean, that's in certain areas, I can imagine the piles of rubbish everywhere, and the kids play there. And that's the problem, is that these little children, they don't know. They're busy playing in these rubbish dumps. And, I mean, they are the most vulnerable. They can get exceptionally sick. So, again, it's to educate parents to keep their kids away from this rubbish and wash your hands.
And they wash their hands, but also the difficulty about this situation is that schools are on recess now, and kids have ample time to be playing around. Therefore, our cautious and empowering communities to understand what is going on is very important, and also to make sure that the rubbish is collected in those areas. And I think of importance and the priority now is to make sure that rubbish is collected as soon as possible, because, as I said, we can prevent these diseases from happening if indeed we implement the right measures, put the right measures in place and collect that. And people must also make sure that their rubbish is dumped at the right place at the right time. So where sites are full, the city must make sure that those interventions are escalated and they're implemented as urgently.
You know, there's also the risk of typhoid, and I know we had a bit of a scare earlier this year.
January, yes.
You know, and that's a big risk, I imagine.
Yeah, the risks are immense, Leanne, and I'm not going to sit here and gloss over those issues. That's why we've said to our infectious outbreak response team, working with the NICD, we must ensure that we are in every community, empowering communities and sharing information with them. But over and above that, the major priority is to get the refuse collected ASAP, because the lack of collection of refuse give birth to these the rats multiply very quickly, and the more the rats multiply, the risk is really high, and we need to make sure that we avoid any human plague from happening. Because when we got information on Friday, we were at Natal Spruit at the Telemokhorane Hospital. We had to make sure that the mayor said, then let's meet quickly and look at this situation, because indeed this is a rat plague, but we must make sure that it does not spread to human beings, because and I think the consequences, South Africans must realize that if we do not arrest this refuse collection very soon, we are all going to be affected in one way or the other. So we have to work together to collect the refuse.
You know, we've got a lot of people writing in and talking to us, and one thing that keeps on coming up is that clearly Pikitup is a troubled company, and there needs to be another company to come in and do their work. But should they not have a competitor? Should they just be almost dissolved and another company starts? Because this is a really dire situation now.
Well, the city can answer that question better, and I think of importance is that I know the city has contracted private companies
for R1 million a day.
Well, but
that's the problem.
It's for R1 million a day, but the question is, do you employ the company for that amount, or do you simply leave the debt to pile up? And the answer is you just have to choose. And the choice here is about making sure that the citizens are protected. This is about our collective responsibility. Yes, as I said, the rights of the workers should not trample those of other ordinary citizens. And I think we must all work together to resolve this matter. I think competition is good in any organization, but I think the city is better to respond to this matter.
Fair enough. I mean, that's not your responsibility. But I know that there's an emergency line on the screen. People are able to call that any time of the day if you would like to report one of the dumps that is full. But as far as I know, all of them are full, and there must be a lot of illegal dumping sites opening up all over the city, and people are just putting their rubbish anywhere away from their homes. Just finally, in terms of our hospitals, I mean, because the waste at hospitals it's dangerous. It's very dangerous. Are they being looked after?
The hospital's waste is being collected. Here we're talking about the food leftovers, we're talking about the paper and whatever. Remember, there's two waste in hospital.
Yeah.
There is a medical waste from tissues, syringes, cotton wool and all of those. That's collected by the waste company and taken to dispose in a particular manner through incineration and all of that. The general waste is collected by municipalities, and thus far in the City of Johannesburg, we've not experienced any difficulties if indeed the there were to be difficulties experienced any minute, we stand ready to make sure that that waste is collected. We cannot afford any stand in any hospital because the consequences will be really too costly to contemplate. Therefore, we stand ready to deal with those, including with the responding to any diseases that may come from this. We stand ready because the way we understand what the NICD has explained to us, that if someone indeed a human plague may happen, people can be treated with the antibiotics, and those we have at our disposal. So we want to say to South Africans, yes, there is high risk. We must be all on the alert, but let's try and make sure that the waste is collected. The important thing is that the Pikitup must really, together with the workers, they must find a solution to resolve this matter before it's too late.
Thank you very much for talking to us here. Qedani Mahlangu is the MEC of Health of the Gauteng Health Department, and it's just become a very, very serious issue. And as you heard the MEC saying, they are on standby for any cases, but the reality is this picket stripe has to end very, very soon, because the residents in this area of Gauteng are facing a lot of diseases and viruses if it isn't ended very, very quickly. All right, let's take a break. When